Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. Welcome back to Bad to the Bones. I'm your host, Debbie Rody. Today we're talking about where fitness and sports health are heading and how recovery and regenerative medicine are changing the game. Fitness today looks very different than it did even a few years ago. We're seeing smarter training, more data-driven decisions, more focus on recovery, and growing interest in biologic therapies like PRP, stem cells, peptides, and CBD. So what's real, what's helpful, and how do these trends actually impact joint health and injury recovery? Joining me today is Dr. Adam Zucconi, Medical Director of Occupational Medicine at Premier Orthopaedic Associates. He is double board certified in sports medicine and family medicine. He works at the intersection of performance, prevention, and recovery. Dr. Zucconi, welcome to the show.
Thanks for having me.
We're excited to have you here. We have a lot to talk about. Fitness is evolving a lot, and you see it firsthand. Let's talk big picture. How do you see trends evolving for 2026? Like, what kind of big shifts are you seeing?
I'd say the biggest shift I've seen across all patients is people are really starting to focus more on strength training as opposed to just exercise.
Yeah.
So if somebody is they go to the gym, they usually have a plan. It is resistance-based. It is not something where it's you're not seeing so much of just the activity-based or just what you'd call like routine exercise, which I think is a really good thing.
Yeah.
People are lifting weights, doing resistance training, calisthenics, whatnot, younger. They're doing them older.
Yeah.
And they're maintaining them for a longer period of time. Biggest area where resistance training and fitness is in the weight room specifically, or resistance training, if you will, has been female athletes, like a real push on resistance training and actually strength training versus the idea of I'm going to bulk or get big or this or that, but actually, really fitness training, really doing resistance training has been the biggest change.
With all of these fitness trends, what do you see as being a trend that is going to define the next couple of years, if there is anything? Is it like technology, AI stuff, mobility? Do you see anything standing out?
Actually, everything you just hit, yeah. So I do see AI is great for the fitness world, I think, in my opinion. I mean, if you just punch in, if you're going to pay for a strength coach and you're talking about $150 a week, you can actually ask AI generators, produce me a 4-day-a-week, 30-minute, you can get very specific topics. Like I want 4 days a week, 30-minute sessions, total body fitness with compound lifting, and they'll give you a printout of this routine. Is it vetted by, a strength and conditioning specialist or a certified strength and conditioning coach? Maybe not.
Right.
But then when you go across the opinions of different trainers, they don't see eye to eye on almost anything. So it gives you a great starting point, and you can and then after you do this, it punches you out. Do you want beginner, advanced? Do you want body fat loss? Do you want strength focus gains? Right. You can ask it as many questions as you want, and it curtails this program for you. Yeah. It even then gives you demonstrations of how to do it properly. I mean, the forms, you can even ask it, well, I have access to a home gym versus a Planet Fitness or a Giant.
Yeah, that's a great point.
Yeah, so I think they're actually very good for that.
And what about all of this data-driven technology? We're all wearing our smartwatches, or people are hooked up to things at night, monitoring their sleep and checking all of their levels and how many steps they're getting in. I mean, are you seeing people being really hyper-focused on all of these metrics and trying to apply them into their life? Does all of this matter?
People love their different wearable technologies as to what is. They like looking at their data points and seeing that they've had good recovery or good rest or good this sleep or that sleep. I think they have a role in the high performance athlete where they really have to look at the recovery. 90% of people could listen to their body and are they getting enough rest? Are they getting enough sleep? Those metrics they say that they can tell like how much you've pushed yourself. So if you're trying to do resistance training, you're trying to build strength, you have to stress the muscle, you have to push a certain boundary, and they tell you like maybe you're overstressed it or overdid it. you could also listen to the muscle as if you did it. I did too much.
Right.
I myself have worn one for years.
Yeah.
I thought it was very useful to track certain activities for calorie burn. If I went and played a round of golf, how many calories did I burn?
Yeah, that's what I did.
That was actually pretty interesting to see. Like, it was 700 calories for 4 hours of golf, whatever it was.
Yeah.
But after you've worn it for a year, you pretty much have your metrics, you have your averages.
Yeah.
You see your sleep patterns. Do you still want to pay in the $40, $50 a month or whatever they charge? I mean, some of them, I think the one I did was about $30 a month.
Yeah.
That's
Yeah,
$30 a
it
month.
all adds up when what does the metric really mean though? Why are we monitoring all of this, right?
Correct.
Like, what is it doing for us?
And then you have the ones that are your ring, or you have the ones that are a wrist
Yeah.
bracelet, or the one you wear across your arm, or if you watch any professional athlete after a game, they'll take off a jersey and whatnot, and you'll see them wearing basically a strapped chest monitor, which is tracking how many kilometers they ran,
Yeah.
how much their average heart rates are, and that's for their strength and conditioning coaches to monitor what they did, and are they going to do load management. You see a lot of that at the highest level. For the average person, is it worth the investment? It's cool to look at.
Yeah.
I don't think it changes necessarily what you're going to do.
Yeah. And how about the recovery side of things? It used to just be, your muscles are fatigued, you let them relax, and you get back at it. Nowadays, it just seems like there's people really taking even recovery mode to the next step. Whether it's like trying to do stuff with your nervous system, taking cold plunges, and what are your thoughts on the extreme recovery options?
Recovery is, it depends kind of on the age of the person who's doing the exercise. The younger you are, the less, with kind of the chaos of youth sports right now, young kids need actually more time to recover. Every sports medicine association across the country does not recommend kids are playing a single sport every day, all day.
Yeah.
So the sports medicine community disagrees with sports specialization before a certain age, and that turns into, I play, let's just pick on baseball for a minute. I play spring ball, I play fall ball, winter workouts.
Right.
So those are the, if you're a parent with a kid like that, it's okay, I want my kid to be shut down for several weeks after every season to actually recover. Kids require more sleep than adults do.
Yeah. I don't know about that. I'm starting to require a lot of sleep these days.
Kids need more sleep than most adults do. Adults don't sleep as well as kids do.
Yeah.
So adults have to actually fixate on their sleep to recover.
Yeah.
And sleep is a learned behavior. It's actually not as natural as people think it is. Like, you close your eyes and fall asleep. So it's a learned habitual behavior.
But that's such a great point that you mentioned about the kids needing a lot of recovery time, because sometimes I find, even just like with nieces and nephews, they want to push themselves. They want to play. And I guess it's,
They want to play, they want to practice, they want to train. I mean, I have 11, 9, and 7-year-old girls, and there's 7 nights. This past week was 7 days in a row of soccer.
Oh my gosh.
2 different teams, tournaments all over the place.
Yeah.
There is a burnout effect, and it is an exhaustion. I mean, they get in the car ride on the way home, and they are asleep immediately. Oh. So I mean, they are cooked.
Yeah.
And young kids need to recover. Adults need to listen to their bodies and recover. Now, as you get older, if you push the muscle, you do require more time to recover.
Yeah.
The highest sports organizations fixate tremendously on recovery for the older athlete and the older weight trainer and the older person who's getting into it, because the more you push a muscle, the more you try to grow a muscle, it needs to recover.
Yeah.
So you can't just keep pushing something back and back. You can't keep doing it every single day, and it's actually not great for joint health and your overall health to begin with.
Yeah, I was just going to ask you. I'm sure there's risks involved in having these kids, allowing them to, or them just wanting to do it and pushing themselves like that.
Yeah.
Well, that might be a good segue into the growing area of general sports health, like the biologics and the regenerative therapies and such. Like, what are sports health biologics? If that's even the right way to ask that question.
So when people talk about biologics in sports medicine, most of what they're talking about is access to things like platelet-rich plasma therapy, PRP therapy,
Yeah.
or something like platelet-poor plasma. So you have PRP and you have PPP. Platelet-rich plasma is a technique that's been out for quite a while, where we draw venous blood from the patient from just a routine blood draw. We spin it down into the plasma level, which is call it the yellow section of your blood after you spin it down. We then are trying to maximize the degree of what's naturally occurring in your circulating blood volume to maximize some of the healing factors that we know. So it's not really theoretical. We know that the healing factors are there. We know that some of the cellular repair mechanisms are there.
Yeah.
We concentrate it, maximize it, and directly put it into the area of inflammation. It's not, or inflammation, tear, etc.
Okay.
It's not necessarily different than when you twist an ankle and your ankle swells. Well, the swelling that goes there is signaled from trauma and recruiting of tissue.
Right.
So you're trying to take that mechanism, amplify it, maximize it, and concentrate it into a dedicated area. Some of the regulation on it is difficult because there's different, almost like a recipe. Everyone has their own recipe.
Yeah.
Whether you use a kit from a manufacturer, whether you use just a centrifuge. Some of the difficult things are in the research of it is, well, what's the proper amount of platelets, or what's the proper amount that you need? That's very difficult to quantify in terms of this amount of platelets did better than this amount of platelets. You can find evidence to suggest that they've really broken them down and tried to maximize an actual number of what's going to be the magic number to heal you. And that's one of the barriers to insurance coverage.
Okay.
Because nobody really knows exactly what is going to be the best. Like, is this company's PRP kit covered and this one's not because they have more, they have more scientific-based data for outcomes and recovery. The PRP is probably the most mainstream of the biologics.
So when you decide that someone is a candidate for PRP, well, let's start with, how do you decide that someone is a candidate for PRP?
A lot of it depends on the degree of injury or damage. Whether you use advanced imaging, MRI, musculoskeletal ultrasound in the office. Is it partial tearing? Is it something called tendinosis, which is wear and tear of a tendon without necessarily having tendon tear? A tendon's not ripped off the bone.
Right.
Tendinosis, tendinitis, tendinosis is a chronic inflammation of a tendon.
Okay.
Tendinitis is acute inflammation of a tendon. It can be used for both of those. Then you have partial tearing. Then you also have, where's the patient's overall functionality of their joint? Does the rotator cuff have partial tearing? That generates pain and limitation, but the function of the shoulder is normal. So the motion's good, the strength is good, the limitation is pain. You find yourself in a rotator cuff patient with poor function, poor range of motion, poor strength. You're not going to just say, you're here, it's day one, nice to meet you, here's your PRP injection.
Right.
That would be something where, if you're choosing your patient candidacy, if they have a full thickness rotator cuff tear, they don't necessarily need surgery. They can heal without, they can recover without, they can do therapies, they can do lots of different modalities. If they're a candidate for PRP, though, that's a discussion that comes down the road after review of MRI, ultrasound, et cetera. The difficult thing becomes the PRP not being insurance covered is the cost of which. So depending on the company you work for, like Premier, et cetera, we have a PRP plan. It's a cash-based service.
Right.
Sometimes I've seen them in other companies, in other places. I've seen them very expensive, which you are taking a little bit of if it doesn't work, if it doesn't provide the result that you want, did you have a significant out-of-pocket expense?
What are the expectations that a patient has or is told when you're given, say it's given for a shoulder injury? Is that common?
All patient expectations are they're 100% better and they feel perfectly fine and they'll never come back again.
Right.
That's what patients want. It can be very difficult to achieve.
Yeah.
But the way I do it, and the way most of the doctors at Premier do it, is much more about, can I achieve an acceptable level of pain control and excellent function that you do not want to pursue this type of surgery. And some of those surgeries that, like if you have chronic tendinosis, and I think some of my surgical colleagues would agree, they don't want to take you to the OR to try to fix a chronically tendinotic or a chronic type of tendon like that, because the outcomes of trying to fix that tendon, the surgical outcome, is not necessarily ideal.
Okay.
So now you have a person who's been through surgery, and now you're kind of back at the same kind of limitation.
Yeah.
If it's a full thickness tear, there's plenty of reasons to have shoulder surgery, knee surgery.
Yeah.
Plenty of indications to do it. There are people that fall into that middle ground where they have this, they have a limitation, they have a problem. They've done cortisone injections or steroid injections, if you will. They've done physical therapy. They still have a limitation. And then what else can be done?
Right.
Whether that be PRP, shockwave therapies, the different modalities of treatment that are different than, say, the usual. Like, it's not just corticosteroid injection or surgery.
Yeah.
So, and then the way I do it is give them the facts. This is what the literature will tell you.
Right.
This is what the expectation will be. And if we give it a shot, if we give it a chance, it doesn't necessarily heal faster. It can still take a 6 to 8 week, 12-week period, depending on what you're trying to heal. It's a non-surgical alternative, minimally invasive, very easily performed. And patients come from all paradigms. They do well, they do poor. Some I've had successes. There are some people that doesn't respond to it.
So are these biologics basically reducing inflammation or kind of forcing blood flow to the injury so it promotes faster healing, or both? How?
Combination of all of it. So it does promote cellular migration. So you get cellular migration to the area of trauma and to the area of injury. You get blood vessel neovascularization. You get increased blood flow, and you'll actually see that on certain ultrasounds and certain imaging to see new microvascularization, which can help with healing and recovery. And then there is evidence that it has acute pain control effects too, which modulating pain fibers from the inflammatory markers. So it can kind of do all of the above. And then the biggest thing is when people say, like, are you going to heal my tendon? Some tendons have a trickiness that they don't actually heal. Oh. Can you accommodate around them? Can you not? If the tendon doesn't hurt as much and you're doing quite well with your function, you can live without maybe that tendon to a certain degree. Yeah. It's a bit of a challenge to say that this tendon is going to heal. Yeah. You can generate scar tissue formation, which in the right tendon, scar tissue can be contractile. It can contract and be attached. There are other times where if you repeat MRIs or repeat ultrasound, you don't necessarily see tremendous amount of healing. Yeah. And that's where, like, the fact of it versus the reality. Just trying to sell it.
Yeah, speaking of facts and, fiction, so to speak, let's talk a little bit about stem cell therapy, what the promise is and maybe what reality is, because I feel like you could shed some good light on that. There's a lot of attention around that of, when a patient should consider that and what it's used for. What does evidence support the use of stem cell that you've seen?
The evidence for, if you call something a stem cell, so there's different kinds of stem cells, whether or not you're using autologous or stem cells from your own fat, which is simply done by almost like a liposuction procedure, whether you use bone marrow-derived stem cells, or whether you use donor stem cells from other sources. Stem cell therapy it's been around for a while. It is still very young in terms of its overall efficacious nature, in terms of its ability to regenerate. Like, that's kind of a tricky word to use in terms of, I'm going to make a new tissue. Right. You don't necessarily want to make a new tissue. If you put stem cells for knee arthritis, and the goal here is to regenerate cartilage, that can be a tough selling point. So the marketing for the stem cell world sometimes seems to be the cure-all for your aches and pains. Yeah. They can be very expensive. stem cell harvesting, stem cell laboratories to process your stem cells, so you're actually getting stem cells, can be very expensive. None of it's covered by an insurance carrier.
Oh, wow.
There are localized stem cell procedures that you put into a joint directly. There are other ones where clinics and labs are giving you IV systemic stem cells, trying to target all of your inflammatory markers. The cellular mechanics of trying to take a cell that's not differentiated to attach to another cell to help it either regenerate or heal. There's a lot of theoretical versus actual objective evidence on that. And that's where it's a viable option. And we've done several stem cell procedures at Premier. It's a viable option for people when they're looking at a condition that if you're a younger person and you have knee osteoarthritis or it's called an osteochondral lesion, not necessarily a true, because there are other treatments for cartilage transplants and things like that. But if you have something that is truly, you're looking at a knee replacement or nothing, I think it can be a viable option. Okay. There are plenty of success stories from stem cells. And there are plenty of things that seem to be social media driven or it's anecdotal evidence where my rotator cuff was torn, I did stem cells, and now I'm a lot better. Well, lots of people recover rotator cuff tears without surgery. Lots of people recover rotator cuff tears without stem cells. Is it going to, if I inject stem cells into my rotator cuff, is it going to take my tendon and heal it back to the bone and make it look like it did when it was 16 years old? That answer is no. So,
that's a hard no.
That's a no.
Okay. So, and I'm sure like with anything else, it's patient to patient based on in terms of how it works or takes,
Correct.
Right? I mean, it's not like a one size fits all for everyone.
And finding people to process stem cells, there are some legal issues with stem cell manipulation. If we can get into it, the only way to change the DNA of a cell to change the way it's going to migrate in the body and create a new tissue is usually through DNA manipulation.
Oh, wow.
So now you're talking about manipulating DNA and injecting it into your body. And there are case reports of people who've done stem cell procedures that have gone awry and they have generated tissue in areas they shouldn't have generated tissue in.
Oh, gosh.
And abnormal tissue. So there are cases of those.
Wow.
It's a big thing with medical tourism. It's a big thing, the professional athlete network. And if you've got the money and you're willing to, be on the cutting edge, if you will, people are doing it.
Yeah, I think we all have access to too much information, maybe. I don't know. How about peptides in this whole conversation? Where does that fit in?
Peptides, in my opinion, peptides are actually, they're fascinating.
Yeah.
The people's access to peptides is mostly social media driven, word of mouth driven.
Yeah.
Anyone who's ever gone on, they're not a prescribed treatment usually from a physician. Most of it is self-generated through, you go online, you buy peptides. Now you have to buy them from a reputable.
Kind of like people are doing the GLP-1s and stuff.
Yeah.
Is that?
Well, GLP-1s are a form of peptide.
Yeah.
So a peptide, being a peptide, it's a protein. It's a protein-based, normally injectable, but most of the time they have oral ones as well, and they signal. So if I inject, the most common peptide used right now that I can tell from my experience is people who want to use the BPC 157 for wound healing.
Okay.
That's probably the most common one.
Like used. We're talking major wounds, like not just a skinned your knee type wound, right?
People use it for, so the selling point is that BPC 157 is a naturally occurring gastric stomach peptide that's associated with wound healing and tissue healing. So they take the peptide, and this is all, there are human studies, there are no safety studies, there are very few human studies where they actually did not necessarily regulate the dose or the indication. And they take these medications, these agents, and they look for the result. Just basically, how do I feel?
Right.
And you can buy them online. They come to your door. You have to find a way to calculate the dose. I do a lot of counseling on if a person really wants to discuss these peptides, I'll do the counseling and tell them what I have.
Okay.
Even before I came in for this, I looked up the most recent. What is the most recent? Is there anything new that came out prior to this conversation that is a human-based model?
Yeah.
Peptides, anecdotally, and what they claim to do, actually the literature suggests that they can be quite effective.
Oh, nice.
They fall into the performance enhancement category sometimes. They are banned by most professional institutions. They are considered a performance enhancing drug. So if you're in the
Olympics,
if you're in the Olympics, you will absolutely be hit for that. So
interesting. Wow. Mm-hmm. So it's heavily regulated, I would assume, right? I mean,
so there's really no regulation on peptides in terms of when you go on a website and you order peptides, they'll come to your door.
Gosh, that just sounds good.
There's very little. When you buy them and they come to your house and you look at the bottle, there's also giant red letters, not for human consumption.
Oh, wow.
So they're considered research chemicals.
Okay.
So the way they get around this is they're considered research chemicals, and it's one of the challenging things with, like in my practice, we have insurance contracts and we see patients from all walks of life.
Yeah.
If you open up an LLC that is an anti-aging or regenerative medicine clinic that's not using insurance carriers, you have different rules and regulations in terms of what you can recommend for medical care. So if I'm recommending a peptide that is not an FDA-approved human therapy, it is not something you can get necessarily from a pharmacy, and you have a problem with it because I don't have any safety data to say it is actually safe.
Yeah.
You are kind of violating a malpractice standard. So it's really more of an individual's decision to try these things.
Yeah. Yeah, I think I want to stay away from peptides. I don't know.
They're not. The way I'm saying it might sound a little bad, but it's actually
just not safe for human consumption.
It's on the bottle, big red letters, not safe for human consumption.
Wow. Very interesting. Well, let's get into something that is safe for human consumption, CBD stuff. Mm-hmm. Our recent partnership with Organics, well, most of that's topical stuff, but I know generally CBD does come in oral as well. So what are your thoughts on the CBD world and how that has a role in sports recovery and just pain?
I think CBD is very good at pain modulation and downplaying pain receptors.
Yeah.
So specifically speaking, like if you want to talk about not just like the regular conversations of I feel better, but actually downregulating pain receptors so the perception of pain is less without nearly any of the problematic outcomes with other pain medications. CBD, the Organics one, is really non-psychoactive. So you also don't have problems with if somebody's concerned about CBD failing a DOT drug test or a teacher or whatever. CBD not being psychoactive, so it's not actually an active, THC metabolite. Right. So down-regulating pain receptors, I think it has tremendous validity in sleep quality. That's if I had to give like my tier list of what CBD is good for, my number one thing would be sleep quality.
Really? Yeah. Well, that also sounds like it's essential to healing too, right? So if you can get some good sleep,
people who sleep better feel better.
Yeah.
There's no doubt about it.
Yeah. Mm-hmm. Yeah. How about integrating biologics with smart training? When patients think about the big picture of biologics, how should patients think about biologics fitting into fitness and recovery and when to use it? Should it be something they lean on or they know it's there as an option? Do you think patients should be their own advocate in knowing all of this when they come to see you for any type of injury?
I think it's too big of a world for them to really have a good hold on, unless they're really interested in really doing their own research.
Yeah.
And they have to be careful what research they get because some of it's not so good.
Right.
So if they're a person who's doing their best with function, like I always tell people, like anything biologic or supplementation, this is it's called a supplement. So if we're going to supplement your rotator cuff tendon because it aches you when you do shoulder press,
right?
Then yes, supplementing that with PRP therapy is something that can help with maintaining a tendon versus trying to put out a fire of an acute injury or something like that. So yes, there's tons of patients that will almost have like check-ins every once in a while to help manage their chronic problem.
Right.
Because they're really not, some of them are, some of them aren't, willing to say, let's scrap it, go in there, fix what we can.
Yeah.
When you're talking about a lengthy recovery, physical therapy, limitations, work, people can't take off work and they have, other limitations. Not everyone really wants to be a surgical patient because they have an issue. Sometimes they want to try that. So I think biologics they can be a supplement to help with your healing and help with your recovery. If I had to say, it might be one of the better ways to use them. Mm-hmm. And then like all things that are supplementation, if you're doing the 90%, you're following a better diet, you're getting better sleep, you're doing the things you're supposed to do, your body will do better. It'll recover better. It'll heal better. It will feel better. So anything that you're supplementing should only be a very small percentage of your routine. Most of it should be the old-fashioned stuff. It should be proper diet, calorie control, resistance training, recovery, sleep. If you're doing most of those things, your ailments, most of your problems will actually be better anyway.
Do you have any or one patient or anyone that comes to mind of where you've used any form of biologics to help the recovery of an injury and they've had some pretty good success?
I have tons of them. I have a lot of them. Probably my number one is a patient of mine who's a retiree. He's an older gentleman. He goes between Florida and Vineland, and he has quite a bad shoulder, quite a bit of rotator cuff tearing, retraction, etc. Always did well with occasional corticosteroid injections in the shoulder when he would come into town, and eventually he started to come in more frequently, and we kind of talked about is it time to consider doing the shoulder now because you are retired, you are getting older, you're not necessarily going to heal better in the more time he takes, he's not going to heal better.
Right.
We kind of said to him, I was like, look, he was kind of pushing back and forth on surgery. So I'll tell you what, we're going to see if this PRP is going to be of benefit in this and discuss the risks and benefits. We did a series of 2 injections over an 8-week period. I actually really like him as a patient. I have not seen him in over 18 months.
Oh, wow. So what's the formula for how you determine how much PRP to use? How did they know to take 2 vials versus 1? Like, how do you know how to do that? Like, is it a formula based on?
Nope. No, that's the other thing. It's some of the companies some of the kits you can buy to maximize platelets have certain volumes of blood you would take. Mm-hmm. I've seen them be as high as 60 cc's of blood, which is quite a bit of blood.
Yeah.
I've seen those. I go by some experienced models. Mm-hmm. I will use, if you want specifics, if I'm doing a tennis elbow, I almost always draw 4 tubes of blood when I spin it down because not every tube you get gives you the same volume of plasma. So it'll change. So if I draw 2 tubes and I spin them down and I centrifuge them and I look at the plasma and I go, it's not a lot. I'm going to take 2 more. So I start with like 4. So I'll do 4 tubes, 4 vials of blood, spin them down, isolate the plasma, and I'll use that. Some of the kits give you less plasma because it's more concentrated. So there is no like, this is how much we use. Even some of the doctors in our practice use different amounts. And then, we discuss too, like, how much do you put in a knee? Well,
right.
Well, sometimes for me, I put as much as it'll take. So with ultrasound guidance, I can see how much volume I have, how much I'm separating tissue, how much, if I'm causing discomfort, how much it can take versus trying to force something in the elbow. So I might stop short if I'm satisfied with my delivery. I may, if I'm not getting any resistance and I'm having any problems, and the shoulder has lots of space, or the tendon and the structure has lots of space, I'll do more. Some people, if they're paying out of pocket for if they paid for that plasma and you didn't put it all in, they might
that's gold.
They might not be too happy if you. Then there are times too where you've got extra and you say, where else do you want to put it?
Yeah, that's what I would want to be asked.
Yeah.
That's gold right there. So if we were to talk to our listeners and maybe give them some like future-proof fitness and recovery strategies, anything come to mind for you of like whether it's, different training or pain signals they shouldn't ignore?
No pain, no gain might be the worst advice anyone can ever give you.
No pain, no gain.
Yeah, like the classic, like no pain, no gain.
I still use that today in my own days of training.
I mean, when you're doing something and you are having pain that is altering your biomechanics or how you exercise or how you run or how you lift or how you throw a baseball, get it looked at.
Yeah.
Right? If you're trying to, get back into a running routine, and every time you run, you're experiencing knee or hip pain, you're either doing something biomechanically wrong, or you are losing strength or weakness, or you have a limitation somewhere either above or below the joint, and you should probably think about getting it addressed. Maybe we have to back it down, start off with basics before we get into like a running program.
Yeah.
I don't think that you should be doing, if you're having a lot of shoulder pain and you're trying to push heavier weights because you did it back when you were in high school and you have a lot of pain, you could be on the cusp of a life-altering injury. I mean, it could be on the cusp of doing something that's going to require a reconstruction of a joint, and it's not going to be the same after that.
Yeah, and that doesn't sound good. You hear that, everyone out there? Don't push yourself. It's no pain, no gain.
No pain, no
Don't do
gain
that.
is terrible advice.
Yeah.
Terrible advice.
Dr. Zucconi, this has all been some really incredible information. I love talking about this stuff. It's a great look at where fitness is going and how biologic therapy is playing a role in medicine today. So thank you for sharing all of your insight. We really appreciate it. For our listeners, whether you're an athlete, active adult, or you're just trying to stay strong and stay active, stay mobile, make sure that you are staying within your limitations. And if you hurt yourself, you need to come see Dr. Zucconi. Call someone at Premier. To learn more about Premier and to possibly schedule an appointment with us, you can call or text 856-690-1616 or visit us online at poasnj.com. Until next time, stay strong and keep moving.
I wish I could talk like that with that voice. It's lovely.